Good day. I am Dr. Vincy Naranjo, a minimally invasive advanced laparoscopic surgeon specializing in bariatric surgery, or as you call it, weight loss surgery, here in Davao Doctors Hospital. Our topic for today is about obesity, and I will help you, our viewers, understand more about it. Obesity is a complex disease involving an excessive amount of body fat. Obesity is no longer considered a cosmetic issue that is caused by overeating and a lack of self-control. The WHO, along with national and international medical and scientific societies, now recognize obesity as a chronic progressive disease, resulting from multiple environmental and genetic factors. So in the Philippines, 3 out of 10 Filipinos are obese in this current data. The disease is extremely costly, not only in terms of economics, but also in terms of individual and societal health, longevity, and psychological well-being. Due to its progressive nature, obesity requires lifelong treatment and control. On this next image that I will show you, the photo credits come from ASMBS, or from the American Society of Metabolic and Bariatric Surgery. Most people think that bariatric surgery is an extreme solution for people who end up on TV. But did you know that a typical patient is a man or a woman, aged 35 to 50, with an excess weight of about 100 pounds. So they are not extreme at all. You can see Sarah, our example of a patient. Her BMI is too high. You can see it at 41. She is 45 years old, 5'5" in height, and weighs 245 pounds. In fact, anyone who has a BMI of more than 30 has the disease of obesity. It's according to Sarah's history. Her parents were heavy. She has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. And by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her that she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a healthy diet. But her weight is now out of control. We go into Sarah's mind, or what she is thinking. She wants to be slimmer, but like most people, she thinks it's a willpower problem. She quietly fought this battle on her own, but is now getting desperate. What did her in was last summer, when she was told that she was too big to fit in the roller coaster with her kids. What she doesn't know is that in addition to her frustration about her weight, obesity has put her on a path towards other illnesses like heart disease, type 2 diabetes, and other chronic diseases. What do other people think? Most people think that obesity is a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for the other chronic diseases though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors. And if left untreated, it is deadly. Sarah does not want to be idle and do nothing about her condition until she develops diabetes, has a stroke, or heart attack, or worse. She takes action and asks her doctor for help to find an effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah is having a talk with the bariatric team. The team talks to her about 2 options, sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her bariatric team, she chooses sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions. It takes about an hour to complete, and she spends one night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. Obesity can be effectively treated, but you have to ask for help. Ask your doctor to refer you for a consultation at our Healing Well Center and to our bariatric team here in Davao Doctors Hospital. Again, we hope that you have learned a lot about this topic that I discussed today. So again, to our patients, stay safe. Goodbye.